Neurological diseases and conditions. Guillain-Barré syndrome is an acute, rapidly progressing disease of the peripheral nervous system. The patient will start getting numbness and tingling in the feet, and muscle pain, and it typically then continues to progress up the body. Um, in order to diagnose, they'll do a cerebrospinal fluid sample. The disease usually peaks in 4 to 6 weeks. They'll experience numbness, tingling in the feet and hands, um, muscle pain, tenderness. They'll, they'll have progressive weakness and paralysis, again, starting lower in the body and legs and then moving up the body. Um, Probably considered an autoimmune disease. The prognosis varies, but usually it's a good outcome. Um, They are quite often hospitalized initially, may have to use plasmapheresis, which is similar to dialysis for the blood, except there's a difference to this. Um, this usually helps to reduce the signs and symptoms and recovery quicker. Um, they may have IV human immunoglobulin, and there's no way of treating this. It just comes on and progresses. Brain abscess is a collection of pus that can occur anywhere in the brain tissue. Um, Typically, they'll have symptoms of nausea, vomiting, visual difficulty, stiff neck, pupil size will change. They may have seizures. Um, it typically will progress until they need a quick evaluation. Uh, a lot of times, they'll have a history of a sinus or ear infection. Um, Primary symptom is headache. Other symptoms are depends on the location and extent of the abscess. Um, and the abscesses may cause a localized infection or infection somewhere else in the body. With these, if there's intracranial pressure and they can't control it, it can result in death. They probably will do a lumbar puncture looking at um, uh, the pressure and reducing that. They would give IV antibiotics, mannitol steroids to reduce the swelling, um, surgical drainage of the abscess, and again, prognosis is going to be depend on the location, size, and what exactly is causing it. Poliomyelitis is a viral infection, anterior horn of the gray matter of the spinal cord, and causes destruction of the motor neurons. Those who have previously been in contact with polio as many as 30 or 40 years prior will have an onset of progressive weakness to the affected muscles. Um, Symptoms go along with exposure are the primary ways of diagnosis. Um, they will develop a low-grade fever, discharge the nose, and uh, feel weak and tired. Uh, Symptoms are followed by progressive muscle weakness, stiff neck, nausea, vomiting, flaccid paralysis, so paralysis with no movement, muscle movement. Um, it enters the body through the nose and throat and crosses into the GI tract and reproduces in the lymph tissue. Treatment: analgesics, heat, bed rest, therapy, leg braces, mechanical ventilation. A Sabin vaccine for polio is available. It gives you immunity from one form. Prognosis is fair and depends on what muscles are involved. Um, and an immunosuppressed person should take care in becoming in contact with the discharges or secretions from a recently vaccinated person. Intracranial tumors usually originated within the brain itself or um, as cancers that have metastasized, typically from the lung, the liver, the kidney, or the skin. Um, some of the common symptoms that they may have are headache, seizures, nausea, vomiting, dizziness, uh, difficulty with thinking and processing information. muscle weakness, uh, loss of speech, visual dysfunction. They may have seizures. Um, we see it greater in places like the U.S. and Western Europe, places that are much more industrialized. They can come from any cell within the central nervous system, um, and the symptoms come from displacing and compressing the brain tissue. Uh, Primary tumors are classified according to the cell type involved. Evaluation includes a detailed history, neurological exam, and diagnostic neuroimaging. Although patient brain tumors can be malignant or benign, um, there's even though they are different, sometimes each of those brings some similar damage to the brain and brain tissue. So, from that standpoint, a mass of any kind can be a problem for the brain. Typically, the tumors are treated whether they are malignant or benign in the same manner. Um, the primary tumors are the ones that begin in the brain. Surgery, radiation, chemotherapy, immunotherapy are all um, the methods of treatment. In secondary tumors, these are the ones that have metastasized from some other location. So it depends on the location size and how many metastases there are, the patient's age, their status neurologically, how much the cancer is involved, the rest of the body, how that they are treated. Um, Treatment depends upon what the quality of life will be too. So treatment, uh, relief of the neurological symptoms, and long-term tumor control is the objective. If they have a single brain lesion and no other sites of metastasis, they'll do surgery and whole brain radiation. Um, there's not really any method to prevent the intracranial tumors. Prognosis, the overall 5-year survival rate for any type of brain tumor is going to vary depending on the type of tumor, whether it's primary or whether it is secondary, the age of the patient, sometimes even the gender of the patient. Um, successfully, success rate of treatment, gliomas, which is the brain tumors, have the 5-year survival rate of only 5.5%. So even though sometimes they can remove most of them, they can't remove them all, or sometimes there's injury to the brain in the process of removing. So there's a lot of factors that are included in the decision making and the outcome of these.